Erin and her boyfriend Brandon have recently made headlines with their controversial decision to administer marijuana to their 7-year-old daughter, Mykayla, who was diagnosed last summer with an aggressive form of cancer known as T-cell leukemia. Take a look at their story.
7-year-old Mykayla is a very typical and normal child, except for one thing. This little girl is fighting a very big battle against cancer.
Mykayla was diagnosed with T-cell acute lymphoblastic leukemia.
Mykayla immediately started chemotherapy. She lost her hair. There was nausea, loss of appetite. But Erin and Brandon did something bold and controversial to help their daughter.
We got her Oregon medical marijuana card 10 days after she was diagnosed. Instantly, when she started taking the cannabis oil, we saw a very good reaction to it. It controlled her nausea, her pain, every symptom she had, and she just turned into a normal child. I feel that the long-term consequences of narcotic pain relievers are a lot more damaging to Mykayla than a simple organic oil that's made from a plant named cannabis.
Joining us now for their daytime exclusive interview, please welcome Erin and Brandon. Welcome. Thank you so much for being here today. And if you would take us back to the time when Mykayla was diagnosed.
Yeah. This summer, Mykayla got a cold that we thought was a cold, and we took her to the pediatricians, and they did an x-ray to check for pneumonia, just like most parents deal with their kids. And instead of finding pneumonia, they found a basketball-sized mass in my 7-year-old daughter's chest. It was terrifying, scary. I thought I was going to lose her. And
they said it was inoperable?
It was not a normal mass. It's a mass of leukemia cells.
Okay, so the way in which they wanted to treat it was through chemotherapy and radiation.
Therapy, steroids, and cranial radiation, because she also had leukemia in her spine and in her brain.
So, okay, so as a mother, what do you do with that information?
My heart shattered. She is my whole life. And it's just heartbreaking to be so terrified that you're going to lose your daughter.
So you went the route of the chemotherapy, the radiation,
yeah.
You're doing all the treatment that they're saying, but you're also adding your own treatment.
We did go the route they were saying. We did deny cranial radiation, and we took a lesser chemotherapy protocol than they recommended. And we use, at home, we use full cannabis extract oil and treat her with that at home as well.
So explain to everybody why you use that at home and what the benefit is.
I chose to use medical marijuana for Mykayla because I am a medical marijuana patient as well for my own health problems, and it has allowed me to successfully treat my condition with using a minimal amount of pharmaceutical prescriptions, which I feel can cause damage to the body if used in excess. When my daughter got cancer, I instantly knew that she needed cannabis, but of course not like an average adult would need cannabis. So I reached out and contacted the Phoenix Tears Foundation, who sent me up with Cheryl Schumann, and they have just guided me along the process of using cannabis oil to treat her at home.
So to treat her for what? For the side effects of the chemotherapy, or to treat...
The side effects, we treat her nausea, vomiting, pain, depression, anything that can come along with cancer. Cancer is just... It changes your entire world. It makes you feel so sick. She's sick a lot, and when she takes her cannabis, it mitigates all of those symptoms. She doesn't have to use any pain relievers, no nausea medicine. She's not puking. She's up bouncing and running around just like a normal 7-year-old, like she was before she had cancer.
So this cancer that she has is curable?
Yeah, it has with the standard chemotherapy protocol with no cannabis, she would have a 76.9% of survival with a 7% chance of relapse with no cranial radiation, and I think it's a 3% chance with cranial radiation.
Okay, so you chose that to avoid doing that because of the dangers of the radiation to her brain.
Yeah.
So you are speaking out about using cannabis on your 7-year-old. What kind of reaction have you gotten from the community?
very supportive.
Yeah, mostly positive. People seem to understand that when you're fighting cancer with a child, that almost anything is acceptable to help treat it and save their life.
There have been some people who have been against it, and in my opinion, those people don't know what it's like to stand in our shoes, to watch your child be so terribly ill and suffering pain, puking, and not being able to stop it. They haven't necessarily been in that position before, so I don't feel like they completely understand. But for the majority of the people have been completely supportive.
And so coming forward, I mean, do you feel like, what do you want your message to be for others? I mean, because it is a state-by-state thing. You have to live in certain states where it's legal. I guess, what is sort of the word you want to leave with everyone about your plight? And
parents that have children, to be a parent and watch your child suffer is the very, very worst thing you can imagine. Whether it's cancer, epilepsy, autism, ADD, any of those, watching your child suffer from is heartbreaking as a parent. And we turn to the medical field expecting them to give us all the answers, and sometimes they can't. And there are other options out there for people who feel let down by the medical field, or feel like that Western medicine isn't working for them. There's options, and that's why we're sharing our story, so that if there's other parents out there, that they know that there are other options that they could try that can potentially help their child.
Well, I thank you for being here. We're going to continue talking to you. Also coming up next, is medical marijuana safe for children? Our experts are going to weigh in, and we'll meet a woman with advanced ovarian cancer who says cannabis saved her life. Yes, we are back with Aaron and Brandon, whose 7-year-old daughter, Mykayla, is battling leukemia and legally using medical marijuana to deal with the symptoms and side effects. Also joining us is their friend and advocate, Cheryl Schumann, who started speaking publicly in favor of medical cannabis during her own battle with ovarian cancer. And now you're helping this family. Can we talk about treating a 7-year-old? Is it the same thing because it's, you know, a child that we're talking about?
Well, here's the thing about cancer. Cancer doesn't discriminate on age. You can be 52 like I am, or you can be 7 years old. The bottom line is these patients need treatment, and cancer, I've found, and a number of people found, to be not only an effective treatment, but it saves lives. It saved my life, and that's why I've dedicated the rest of my life to being an activist, to working in this industry and helping people.
And I know you've brought a bunch of stuff here to show us, educate us all on ways in which we can use medical marijuana.
Okay, well, here's my Martha Stewart of marijuana time.
All right.
Most people, when they think of marijuana, they think about the ground herb here. This is not real marijuana, but this is what most people think of. They think of a joint or a pre-roll or a doob or what have you. They pull it out of a doob tube and then they smoke it. However, cannabis today is a multi-billion-dollar industry. It's a $1.7 billion industry, and what people don't know is you can juice cannabis. You can use it in oils, butters, tinctures, so anything that you cook with, you can do cannabis-infused cooking. This is a great example of some edibles. You can make cookies, brownies, lemon bars.
Those look good.
They're really, and they're delicious. They really are.
And I am a little hungry.
But what's happening, and you've seen it all over the news, 60 Minutes was just talking about the industry. It's a $1.7 billion industry. This is some samples of some medicated chocolates. The packaging is fabulous. These are some hard candies. And then if you want to...
I do have a little bit of a sore throat.
But this is the latest vaporizer. It's called a Cannacig. And this product basically is an e-cig for cannabis oil. And what I like about it is anywhere you can use an e-cig, you can use this.
I don't even know what an e-cig is. What's an e-cig?
Electronic cigarette.
Okay.
See, there's just a slight bit of vapor.
And there's no marijuana in there right now.
I put peanut oil in it just for the show.
Okay.
But it's great because it's the same oil that cancer patients use. It's the same oil that Mykayla uses, I use, and it's a much healthier, effective way to use cannabis, and it's very discreet. I always laugh because I keep mine right here in between Thelma and Louise.
So does Mykayla smoke this? No.
No.
How does she get her medicine administered?
In a capsule.
She takes it in a capsule form. She takes 0.5 grams twice a day.
Of the oil?
Yes.
Okay, thank you so much.
Well, one thing I have to tell you, this company, I have talked to them. They have agreed to donate 15% of all their profits for Mykayla's health care.
That is wonderful. Gives me chills. Thank you so much. We're going to stick around. We're going to take take a quick break. Coming up, more on medical marijuana, plus exclusive home video of a day in the life of 7-year-old medical marijuana patient Mykayla. That's next. So what is life like for their daughter? Aaron and Brandon gave us an exclusive look into Mykayla's world. Take a look at their home video.
What are you doing?
Coloring.
What are you coloring?
A picture.
Mykayla is a normal 7-year-old girl. She likes to color, take walks, and play with her sister.
Man in the moon began his journey.
Mykayla has cancer.
When I take cannabis oil, it makes me feel good and energized. And it doesn't make me sticky anymore.
What we're about to do is give Mykayla her morning dose of her RSO, her full plant extract of cannabis. We give it to her in lime-flavored capsules. I get the weight of the pill first, and then I take and I inject half a gram. Once I get the half a gram in there, I take it into Mykayla, and she takes her morning dose. It lasts until the evening time, and we have to give her her second dose.
When I don't take my cannabis oil, it makes me feel really, really, really sick.
So is it an easy process to get and to give it to her?
We had to take her to this clinic and get a doctor to agree to let her use medical cannabis for her symptoms of chemotherapy, because most regular doctors, like her oncologist, would not sign the recommendation.
I wanted to get Dr. Bierman also involved. He is one of America's foremost experts on medical cannabis and heavily involved in this ongoing debate. Okay, jump right in, Dr. Bierman.
Well, for instance, in this instance, that you have a lot of potential benefit, and I think the risk is very low. What people don't realize is that there are at least 15 different cell types in tissue culture and in mice that are responsive, that are killed by cannabis.
Well,
Stupid monkey.